So the main motivation was that classical machine learning methods that had been developed before deep learning were not accurate enough to do the kind of task that we are trying to achieve. So it's purely based on, deep learning has shown better performance in other tasks, in other fields, not necessarily medical fields. And we saw that, and we really got interested into this because of that, and we've tried to then transfer deep learning to medical applications. So what we are trying to do is to develop automated method to score tissue biomarkers, which are commonly assessed by pathologists, by doctors, to diagnose cancer and also to orient on which treatment should the patient receive. And we are doing that because we think that it could be useful for pathologists to get algorithms, give them second opinions very rapidly if the case is particularly difficult. I think the main things that we have to work on now, and including my project, but also different talks that I've seen at the conference, is that we need to get out of our nice, very controlled environment with very clean data into the real world of healthcare, which is messy, with data that comes from different sources, and we don't really know at the moment how this is going to work, deep learning in the real world of doctors and hospitals and so on. Well, I think we've seen quite a few good examples at the conference. I've been really excited with the things that I've seen to enhance vision with people that had almost lost all their vision, and then you can use deep learning to kind of restore vision, and they can see their friends and family again. And also things to help doctors to help them to cope with the increasing demand. So we know there are less doctors, and the population is aging, there's a lot of patients, so we need machines to try to help doctors to give better diagnosis. Well, I think maybe increasingly we'll see automated system that can give some information that the doctor will have trouble to access, so like interpret genetical data, which is very complicated to do, or interpret images, and I hope deep learning will enable to provide a type of information to the doctor that otherwise would be very difficult to analyze for them, this information can help them make better decisions. Well, I think we've seen a lot of applications for imaging, so in radiology to make more accurate diagnosis, in pathology as well. So we know that deep learning is very effective on images from other fields, and now we are showing, and many studies are showing it, that it's also very effective on biomedical images. So I think that's the field which will be impacted first, because that's where deep learning is the best validated, and then maybe in the future we'll see other applications like in genetics, or to make like a virtual doctor if you want. You can talk with a robot, but this is probably more in the further applications. Yeah. We already seeing things at the moment with startup companies that develop deep learning applications to help radiologists, and I think we're going to see more and more products in the area of biomedical imaging in radiology and pathology at the moment. Yeah.